Hello everyone. So yes, am I audible? Is the screen clear so that we can start the session now? Those who have joined, let me know. So today we are discussing the general anatomy part 2nd. So in this session I am going to discuss about skin and fascia. So I will discuss the skin and fascia in this session. Myself, Dr. Monalisa, has done my MD Anatomy from Armed Force Medical College, Pune. So before starting the session, few important points which I want to tell you about the platform of Unacademy. So if you want to see the free sessions on the Unacademy platform, you have to download the Unacademy app. So you have to download the app and find your goal as NEET PG. So you have to find your goal as NEET PG. So you will find your goal as NEET PG. Yeah, and thereafter, after finding your goal as NEET PG, you have to use my code as an unlock code, that is ANAT10. So what you have to use? You have to use the code ANAT10 as an unlock code. So this is my code ANAT10, which can be used by you as an unlock code. Okay. So yeah. And also I want you to give information regarding my upcoming free sessions. So NEET PG 2021 has just occurred. As we know, NEET PG 2021 has been taken on 11th September, and recall MCQs I want to discuss. So I have catered some of the MCQs relevant to the topics which has been asked. So we will discuss it tomorrow exactly at 6 p.m. So those who are interested can join me. So 6 p.m. tomorrow we will discuss the recall NEET PG Anatomy MCQs 2021. Okay. So those who want to join me for this session, they can use my code ANAT10. So they can use my code ANAT10 and be present for 6 p.m. session. Also for the general anatomy, so the topic next which I want to discuss is the joint. So general anatomy, so this is exactly going on as I have started with the general anatomy series. I have started with the general anatomy series on the Unacademy platform, but its part 3rd, which is consist of the joints, will be discussed again on the platform of Unacademy. So a special free session, again you can use the code ANAT10 for unlocking the session. Now let me tell you about few important points about, so I just want you to tell important points about the special class features. So special class features is just concentrate on the first point. As you can see here, the first point is interactive live session. What does this mean? That whenever you are present for the session, you can interact live with the top educators of Unacademy platform during this session. And the next important point which has been shown here is the polls are conducted. So the polls are conducted among the learners and they can clearly know where they are lying among the other competitors. Raise your hand and have a live interaction with the top educators of Unacademy platform. Never miss a session. So if you start following, for example, if you have seen my session and you start following me, thereafter you will get the notification of all my sessions. So you can be present for the session. Now, after completion of the session, you can also take the lecture notes in the PDF form. So just after completing the session, you can have the PDF notes and anywhere, anytime read from the top educators on the Unacademy platform. This is the code which can be used. So also let me explain you about the plus subscription. So when I am talking about the plus subscription, it means you can access all the 19 subject sessions on the plus platform taken by the top educators from the medical field who are completing all the 19 subject for competitive examination. So test your preparation with the other students and know what is lacking in you and what are the subjects or area which needs to be more given time and more of revision is required for that points. Study on your device of choice, assess more than 25,000 MCQs which are based on the latest pattern, and the detailed explanation is provided by the top educators of Unacademy platform. And also, as we know, there is already there is printed notes provided with 1 or more year of subscription. So just go for plus subscription, use my code ANAT10 and get 10% discount. Now, what are the benefits of iconic subscription? So when we are talking of iconic subscription, you can assess the benefits of 2 important platforms. One is the plus platform of Unacademy, where every 4th session is a doubt clearing session, and all the benefits of the prep ladder is added on. All the benefits of prep ladder is added on. So you can study from the top educators of the prep ladder, dream team of the prep ladder. You can assess the dream notes of the prep ladder. So you will get the printed notes of prep ladder, rapid revision and snapshots, QBank 3 video lectures can be assessed by you, clinical and integrated essential sessions. Now, I would also like to give you information regarding the highly effective QBank series of the Unacademy platform, where 25,000 and more high yield clinical MCQs from all the important 19 subjects will be discussed and will be based on the latest exam pattern, includes a detailed description and explanation provided for each and every MCQs. You can get this subscription by using my code NAD10. So you can use my code NAD10 and get 10% discount. I also want to tell you about boost your medical preparation. So you can boost your medical preparation by taking 2 years of subscription and getting additional 4 months of subscription absolutely free. The other point is you can take 12 months of subscription and you can get 2 months of subscription absolutely free. So for these subscriptions, just use my code NAD10 and get 10% discount. So yes, 1 month package benefits is here. So you can be the part of this 1 month package benefits which has been shown here. Ultra fast high revision batch, emergency room MCQ batch, NEET PG test and analysis batch, Gland test, COVID test and last 3 year previous year questions bank. That is all the benefits which is provided to you. Also Focus Next 2022 batch and Focus FMG batch 2021. So these are the batches which is going on. Use my code and get 10% discount. Now I also want to tell you about the professional third year batch which is starting by me today itself, that is 14 September. Entire anatomy will be completed in this batch. So if you are interested, just join me and take the subscription of Unacademy and get 10% discount. Also clinical examination procedure batch is starting from 15 September. So my dear aspirants, I also want you to tell about the NEET PG subscription, where the merging of Iconic and Plus is going on. So you can be the part of this series. Use my code NAD10 and get 10% discount. Also there is more than 10% discount, that is approximately 15 to 20% discount, which is right now going on the platform of Unacademy. So if you are interested, just go for it, take the subscription, use my code NAD10 and get 10% discount. So this will be highly beneficial. And before starting the session, please note down today. So I would like once more to tell you about my tomorrow's session. One is so please do join for this session. One is tomorrow is 15 September. One is the general anatomy joint session. Another important session is the NEET PG 2021 recall anatomy MCQs. So don't miss this golden opportunity. Be present for this session, and the timing of the session is, first one is 6 p.m. and the second session is 7 p.m. So do present, use the code NAD10 if you are using the platform for the first time. So let's start with the session now, that is the general anatomy series. So today I will complete the general aspects, so general features about the skin and the fascias. So let's start with the skin. Actually skin belongs to integumentary system which is covering. So whole of integumentary means that cover outside the body. What it is doing, it is covering the whole outer aspect of the body. So it is consist of following structure. It is consist of skin, hairs and glands. So what you can say, integumentary means it is covering outside the body. It is covering skin, hair, nails and gland. It is forming a covering from the hair, nails and the glands, as you can see here. And here these are called as the skin appendages. These are called as skin appendages, okay. And the skin appendages, so we will discuss each one of it. These all structures are belonging to integumentary system which is covering the outside of the body. Now, so let's see the basic information about the skin. It covers the whole of the external aspect of the body, and it is continuing with the mucous membrane at the orifices. So at the oral orifices, at the oral orifices, at the orbital orifices, these are the orifices where the skin is getting continued with the mucous membrane of the orifices, the largest organ of the body, and it is accounting for 7% of the total body weight. Surface area is from 1.5 to 2 square meters. Thickness is corresponding to 0.5 to 3 mm, and it is consist of 2 layers, that is epidermis and dermis. So which 2 layer? It is consist of epidermis and that of dermis. These are the 2 layers which is constituting the skin. Okay. Now, let's start with the layer. So, I would also like to add on the information that epidermis, as we know, epidermis is a superficial layer. So, yes, here you can see here, if I enlarge this diagram, this is the epidermis, this is lying superficial, and the deeper aspect of epidermis is resting on the dermis, and the subcutaneous tissue which is lying below the dermis is the hypodermis. Okay. So, let us discuss also the dermis layer is made of two layers. So, let me tell you about the two layers. The two layers which is constituting the dermis is the two layers. What is it? One is the reticular and the other is papillary layer. So, it is having two layers, reticular and the papillary layer. And the other important point about epidermis layer is that it is avascular, it is having cells, and the arrangement of the layers is in the form of strata. The arrangement of epidermis layer of the skin is in the form of strata or layers. Okay. So, now coming to dermis and the epidermis. So, here what you can see in this diagram, that epidermis is the superficial layer which is resting on the dermis. The dermis is just having a projection dermal papilla. So, what happened? Epidermis lower part is called as epidermal ridge, and this epidermal ridge is fitting in the dermal papilla. Okay. So, what you can see, the connection between epidermis and dermis is the dermal papilla is there. Okay. So, there is dermal papilla, there is dermal papillae. Okay. The dermal papillae is fitting with the epidermal ridge. Dermal papillae is fitting with the epidermal ridge. Okay. So, as you can see here, two layers are there in the dermis, papillary layer of the dermis and reticular layer of the dermis. Okay. And whole of the epidermis is made of following 5 layers, that is stratum corneum is the superficial, then is stratum lucidium, then is granulosum, spinosum and basale. How many layers the epidermis is having? Stratum corneum, stratum lucidium, stratum granulosum, stratum spinosum and stratum basale. So, see here, the layers of epidermis as we go from superficial to deep is it is consist of stratum corneum, stratum lucidium, stratum granulosum, spinosum and basale, which is resting on the dermal papilla, and the dermal papilla and epidermis is interlocking with each other. So, you can see here the projecting part of the dermis which is getting interlocking with the dermal ridge. So, this is the projecting part of dermal papilla which get interlocked with the epidermis. Now, let us discuss the epidermis layer in detail. So, epidermis, what is the lining epithelium? The lining epithelium of the epidermis is stratified squamous keratinized epithelium. What is the lining epithelium? It is consists of stratified squamous keratinized epithelium. So, please write down, this has been asked as an MCQ, the lining epithelium. Then you have to know how many cells it contains. So, it is consisting of 4 cells, and it is having mainly it is consist of 4 important cells, and it is made of 5 layers. Just now we have seen the layers of epidermis. Epidermis has got stratum it is having stratum corneum as is the superficial layer. Next is the stratum lucidium, then is the granulosum, then is the spinosum, and the resting layer or the more deeper layer of the epidermis is stratum basale. So, it is exposed to the external environment, the function is protection, and the cells of epidermis are, it is consist of following cells, it is consist of keratinocytes. Okay, the cells, 4 important cells of epidermis which is mentioned here is, it is having keratinocyte, melanocytes, Langerhans and Merkel cells. Keratinocytes, what is the role of keratinocytes? It produces keratin for the strength. Melanocyte is contributing the skin color, and Langerhans part cells is forming the part of immune system. Merkel cells detect touch and the pressure. So, Merkel cells is for detection of touch and pressure. Got it? Now, keratinocyte cells, all the cells has been shown in the layers. So, stratum corneum is lying here. You can see the Langerhans cells has been shown here in the stratum spinosum. Also, keratinocytes more superficially, stratum basale resting over the dermis. Merkel cells, all these cells are very important, and we have seen in brief about the function of each kind of cells. Okay, keratinocytes is for the production of keratin, melanocytes for the skin, Langerhans for the immunity, and Merkel cells detect light touch and the pressure. So, you have to know the function, and these are the cells residing in the epidermis layer. Now moving on to the layer over which the epidermis is resting. Epidermis is resting over the dermis layer. The superficial part of the dermis is papillary layer, which is consist of areolar connective tissue. In this, the loose connective tissue, the other structure which is residing is collagen fibers and elastic fibers. Superior surface of the dermis is projected in the form of peg-like projection. So you can see here, just in the diagram also we have seen the projecting part of dermis is called as dermal papillae, and it is fitting under the surface of the epidermis, and the fitting of dermis and epidermis. So in which layer of the epidermis it is fitting? It is fitting into the epidermal ridge. Dermal papillae contains capillary loop and that of nerve ending. So please write down this. Okay, so do wrote down this. Yes, yes, Sri, you are right. Yes, Sri, you are right. Yes, it is for touch only. Yes, it is for touch. You are absolutely right, Sri. You can write this information also, the function of each cells. Now, yes. Now coming to reticular cells. The deeper layer of the dermis is reticular layer, and actually reticular layer is forming the main layer of the dermis, and it is consist of elastin and collagen fibers, and the basic function of the reticular layer or the deeper layer of the dermis is it is providing structural strain, it is providing structural strength, and it is also a reason, and the arrangement of reticular layers of the dermis part is important for giving the cleavage lines, and the stretching of the reticular layer of dermis is responsible reason for the stretch mark formation. Okay. So the stretching of these reticular layer part of the dermis is the reason for the stretch mark. Cleavage line and the Langer lines. Now we have seen, as we have just seen, the reticular layer is responsible, reticular part of the dermis layer is responsible for the formation of Langer lines. Actually, it has got a clinical significance, and the importance of these lines are that if we want that an incision is healing at a faster rate without much of formation of scar tissue, always the incision should be made in line with that of so cleavage incision should be made just parallel or in the line of the cleavage lines, and surgical incision should always be given in corresponding to the cleavage line, and this will result in a faster healing and less scar tissue formation. But if you will give an incision just perpendicular, so if you are giving an incision just perpendicular, if we give, for example, if this is the cleavage line and the incision is given, just perpendicular, these are the line. So what you can see, it is given just perpendicular to the Langer lines. What will happen? The scar tissue formation is much more, and the healing time is increased, and cosmetically it will not look a good surgical incision. So we have why this cleavage line is there, because of orientation of elastin and collagen fibers direction is giving in the Langer lines, and always it is important while a surgery is performed that incision is given parallel to the line, less gapping, faster healing, and less scar tissue formation occurs. So I would just like to show you a diagram where you can appreciate the arrangement of the reticular layer of dermis providing the Langer line. So this is arrangement, as you can see in the abdomen region anteriorly and posteriorly, they are running transversely, and as you can see in the limbs, upper limb and lower limbs, they are running vertically. So in the upper limb and lower limb vertically, and in case of abdomen and back, it is running transversely. Now let's move on to the next point, that is the skin color. Okay, skin color is also important because it give about whether the skin is healthy or not. So it is determined by following three factors. One is the pigment melanin, melanoid, or keratin. So actually, if there is absence of melanin pigment, the disease is called as albinism. So see here, albinism is the deficiency of absence of the pigment melanin, keratin, or that of melanoid. Now also what happens if we have got a blood which is having a much more amount of hemoglobin or oxyhemoglobin, the skin color is showing slightly reddish, and it is considered to be a healthy skin. When you go for for high altitude or certain times in a disease condition, what happens, there is decreased blood oxygen level, and this will give the skin appearance blue color. That is the condition of cyanosis. So also it also depends slightly on the thickness of stratum corneum, which is also responsible for imparting the skin color. Now let's move on with the important function of the skin. So if we talk about the important function of the skin which it is performing is protection from the UV rays, sensation, temperature regulation, vitamin D production, excretion via sweating, regulation of pH, absorption, secretion, storage, and reparative function also. So let's discuss one by one, important one. So when we are talking about protection, the important protection the skin is providing is against aberration or ultraviolet rays. It also prevent entry of microorganisms inside, and nails also protects the end of our digits. Okay. Now coming to the sensation, skin is also able to detect sensation. So sensory receptors are located. So there is sensory receptors for, in case of skin, there is sensory receptors for pain, touch, hot, cold, and pressure. Vitamin D production, skin is exposed to ultraviolet light, produce cholecalciferol modified, and what happens actually when the skin is exposed to ultraviolet lights, it produces cholecalciferol, it get modified in the liver, and then it was modified in the kidney, and active vitamin D formation takes place. So what we can say that it is also involved in production of vitamin D. Other important function is excretion. So we know that the important waste products which is released via sweating process is that of urea, ammonia, and uric acid. Temperature regulation is done by vasoconstriction or vasodilatation of blood vessels, which controls when so by dilatation and constriction of blood vessels, the heat loss from the body is maintained. Sweating or sweat gland produce sweat which evaporates and lowers the body. So this is another mechanism of sweating is an important procedure which help us to lower our body temperature, and skin is an important organ which is having certain important cells which is residing there, which is also providing immunity, like Langerhans cells. So yes, integumentary major function, what you can see in case of increased when it wants to lose the heat. So heat is lost across the epidermis by the process of blood dilatation, and when the blood vessels is constructing, it is heat conservation is done. So these are the process which leads to vasoconstriction and vasodilatation, which occurs in response to the hot and the cold environment, leads to maintain the body temperature. Now I would also like to give you certain points about the burn. So the important applied aspect of the skin is the burn. So actually it is important to know that which layer of the skin is injured, whether it is epidermis and dermis, and how we are going to classify burn as a partial burning, or a full thickness burning, or first, second, or third degree of burning. So let's see this explanation. So partial thickness, so two kinds of burn is classified. One is called as partial thickness burn, and the other is full thickness burn. So when we are talking about partial thickness burn, it means the first degree of burn where only the environment of epidermis takes place, and in this case, first degree of burn, the skin becomes red, painful, and with edema. So the example of these kind of burn is sunburn, brief exposure to hot or cold object. And the next category of burn is the second degree of burn, where the damage of not only the epidermis, but it is also involving the underlying layer, that is the dermis. Okay. So red, it is also appearing red, causes pain, blisters, edemas, and approximate time which is taken for the healing of second degree burn is 2 weeks to heal. It takes approximately how much time, dear? Okay, let me know, are you understanding? So approximate time which is taken for the second degree burn to response is 2 weeks to after the 2 weeks to heal. It is 2 weeks to heal. Now the third one is full thickness burn, that is also categorized as third degree of burn, where what happens, both the epidermis and dermis is completely damaged. So this is very important for you to know that both epidermis and dermis is completely damaged here. And here what happens, the color of the skin will become deep cherry red or black, heals by the process of skin grafting, takes long time to heal, and always after the third degree of burn or full thickness of the burn, it always leaves a scar mark. So I would like to show you the appearance of, see here, this is the appearance of partial thickness which is appearing reddish, but you can see so much of charring and blackish color. Here you can see this is the appearance of full thickness burn, where both the epidermis and dermis is completely damaged. So this is the appearance of, okay, so this is the appearance of full thickness burn, and below it you can see the partial thickness burn. Also you can see here in this diagram, then another diagram which I am showing you, which is showing partial thickness burn is involving the entire epidermis and just the certain part of dermis also. But when we are talking about full thickness, whole of epidermis and dermis is completely damaged. Now there is also given a rule of 9 which will help us to estimate the severity of the burn. So we call a burn severe because of the following criteria. So when 25% of our body is showing second degree of burn, 25% of the whole of the surface area of body is involving second degree of burns, means entire epidermis and slight thickness of the dermis, this is considered to be the critical burn. Also, if only 10% of full thickness or third degree of burn is involved in the body, it is characterized to be a critical burn. Third degree of burn involving face, feet and hand. So the burn which is involving the areas affecting face, hand or feet. So these are the example of third degree burn, which is involving the basic areas of hand, feet and face, is again classified as critical burn. So these are the three criteria: more than 25% first degree or second degree of burn, and 10% third degree. So whole of the body surface area having 10% of involvement of the body surface area is third degree burn. And the burn of the face and hand. So please have a look on this. This is very important for classifying the severity of the burn. Now, as a rule of 9, this is a diagram which is clearly showing you the surface area being involved. So for example, head you can say 9%, upper limb 9%, front or back total is 18%, genitalia is considered to be 1% and lower limb is 18%. So this will give you the whole area of the burn being involved. So corresponding of the children, so head is 15%, upper limb 9%, trunk bank 16%, genitalia is 1%, lower limb 17%. So you just have a look on this image which is giving you the approximate idea of how we take the representation of body surface area involved in terms of percentage. So this is how the division of the whole body area is done. Now there is one formula which is called as Dubois Formula. So this Dubois Formula is done to is given there to know the area or surface area of the body being burned in case of square centimeters. So here A equal to W multiplied by H multiplied by a constant, that is 71.84. So please do have a look on this. This is very important. Here A is surface area in square centimeters, W is the weight in kilograms and H is height in centimeters. So what is this? If you this is a formula which can be used by you if you want to calculate surface area of person being involved in case of burn. So this is exactly formula which is used. This is called as Dubois Formula. Now let's discuss in brief about the accessory skin structure. Accessory skin structure, as in the first slide we have seen, it's the skin appendages, that is hair, nails, so glands. So here hair is present all over the skin of the body, except it is not present in our palm, it is not present in our sole and lips and nipple. So except in the palm, in the soles, nipples and the lips and the part of external genitalia, distal segment of fingers and toes. So these are the areas where there is no hair present in our body. Now certain glands which lies in the skin is sebaceous gland, sweat gland, mammary gland, ceruminous gland, okay, also nails. So these are what? These are skin appendages. These are skin appendages. So let's discuss in brief one by one. Sweat gland. What do you mean by sweat gland? So whole of our body is capable of sweating due to presence of sweat gland. So actually sweat gland is widely distributed all over our body, and it is actually blood filtrate. 99% of it is water with some salt, contains trace amount of metabolic waste which is released via sweating. Now sweat gland can be of two types. So the sweat gland, if we talk about the sweat gland, it can be of two types. Here also it is showing. It is actually in the normal histology session I have told you sweat gland is coiled tubular structure. It is coiled. So you will see here it is in the form of coil. So it is a coiled tubular structure. It is a coiled tubular structure or gland. And there are two types of sweat gland. One is eccrine and other is apocrine. So sweat gland in the external genitalias region, axillary region, which is also having produce a special kind of sweat, which is also having few along with the sweating, it is also having a peculiar smell attached to it. So actually these kind of sweat gland is not the basic sweat gland, which is called as the merocrine or eccrine type. This is categorized as a apocrine type of sweat glands. The sweat gland which is distributed all over body is considered to be the eccrine type of sweat gland. So see here, over entire body the sweat gland is present except the palm. So over the entire body we have already seen the sweat gland is produced over the areas of axillary, anal and genitalias region. It is called apocrine type of sweat gland. Now coming to the next, sebaceous gland. So over entire body except, so we have got no sebaceous gland in our palm and soles, and it is a simple alveolar gland. What does it secrete? So it is making the, its secretion is oily in nature, and that is required for giving lubrication to the skin. So the secretion of sebaceous gland provide lubrication, and it is considered to be a holocrine secretion because the entire cell breaks to release the secretion, and the function is softens and lubricates the skin and hair and collects the dirts. So can you see here? So this is a sebaceous gland. Always sebaceous gland is attached in relation to the hair follicles, as you can see here, and close to the hair follicles there is a small muscle that is called as erector pili muscle, that is called as smooth muscle. Now the contraction of erector pili muscle will cause goose skin, and within the cold region our skin hairs stand out vertically because of the contraction of the erector pili muscle, which is causing the straightening of the head of the hairs on the skin. That is called as the goose skin. Now let's see the other modification, that is the nail. So nail is actually a scale like modification of the epidermis, which is lying on the distal or the dorsal aspect of fingers and the toes. As you can see here, this is considered to be the free edge of the nail. So the important parts of the nail, if you will see, this hole is the nail. This is the free edge of the nail. This is the eponicum, which is continuing with the cuticle of the skin, and this are called as lateral fold of the nails. Also you can see here the eponicum or cuticle is lying more proximally, and distally it is also having the free nail edge, and middle part is called as the nail bed, which is also called as the body. Okay, so inside there is nail matrix also, and underlying there will be the distal. What is this? This is the bony part of the phalanx. This is the distal phalanx. Now what is the structure which is making the nail? It is made of hard keratin. The parts of the nails are, it is having body, it is having roots, it is having eponicum or the cuticle. So you can see here eponicum or cuticle is the region of the nail which is getting attached more proximally with the skin. So here this is called as the eponicum. This is called as eponicum. This is the nail root. Inside you can have the inside in the nail lateral aspect on either side there is nail fold line. Underlying to it will be the bone, distal phalanx bone, and also the distal part. So we have got eponicum, which is called as the proximal end of the nail, and the distal end of the nail is called as hyponicum. See here, it is called as hyponicum. So two parts, one is eponicum, that is the proximal end, and the distal end is called as hyponicum. It is also important for you to note down that total an entire nail takes approximately 90 to 120 days for entire nail to grow. Okay, the other important things which has been seen in cases of nails, that the growth of a nail is faster in case of summer than in winters. It occurs faster in the case of fingers and faster in long fingers, and approximate, if we talk about approximate growth of a nail per day, it is 0.1 mm. So 0.1 mm is the per day growth of a nail, and it approximately takes approximately 90 to 120 days for an entire nail to grow. Now coming to the applied aspect, the applied aspect is it provides skin color. So what happens, actually nail is a very important sign to judge the condition of the patient. We see whether in the skin also, or in the sometimes the position of the nail is changed, or there is an iron deficiency anemia. There will be different appearance of nail, crooked nails, and healthy nail is also an important point for knowing whether the skin is healthy. Same with appendages of the skin should also be monitored for being healthy. So the skin, like if it is yellowish in color, that means there can be a case of jaundice. Less hemoglobin, that is pale bluish when there is less oxyhemoglobin. Now skin grafting, skin is also used for grafting. One is the split thickness graft, where the epidermis and tip of dermal papilla is used. The another type of grafting is the structure where both the whole of the epidermis and dermis is used for grafting, that is called as full thickness graft. Now other changes is the developmental aspect changes in the case of skin. Epidermis replacement of the cell. So what happened, epidermal replacement of the cell slows and the skin becomes more thinner. Now in dry case, what happens in the elderly people, skin becomes, lubrication is lessened and the skin become dry and itchy. Subcutaneous fat layer diminishes, it leads to intolerance to cold. Also with the advancing age, the skin will lose its elasticity. So there is decreased elasticity and loss of subcutaneous tissues, and wrinkling will be seen. Decrease in number of melanocyte Langerhans cells, and if there is less number of melanocytes or Langerhans cells, it leads to the risk of developing skin cancer. So what you can see here in this case, you can see an old lady where so much of wrinklings, loss of elasticity has been shown, and these are all age related changes which is seen in case of skin. Now let's move. We have done with the skin. The underlying the skin, when you go for dissection also, you will see superficial fascia which is more fatty, and underlying to superficial fascia is the membranous layer, that is called as the deep fascia. So the other name which is used for superficial fascia is, it is also called as subcutaneous tissue or tela subcutaneata. Okay, so actually this whole layer of superficial fascia is filled with fat, and it connects the skin to underlying deep fascia. The general coating of the body consists of fat, areolar tissue, cutaneous vessels, nerves and lymphatics. What it contains? It contains cutaneous nerves, vessels and lymphatic. Now superficial fascia is present over non-expansible part. It is present in the muscles of pelvic wall. It is present in prevertebral muscles. Okay, it is present over non-expansible part, muscles of pelvic wall, prevertebral muscles, well developed in the form of membrane and demonstrable and can be sutured after giving an incision. These are certain basic characteristic features of superficial fascia. Okay, any doubt you can let me know, anything which you are not understanding. These are all basic points, many of you must be knowing, but a quick revision is important before starting the whole of anatomy. So superficial fascia over the expansible part, that is the muscles of pelvic floor, cheeks and pharynx, do not exist as a demonstrable membrane. Indefinite thin collection of loose areolar tissue. What it contains? It contains loose areolar tissue. Okay. Thickness of it will vary also, because as we know it contains loose areolar tissue, it contains so much of fat. So more of fat will be present in superficial layer in the gluteal region, and also distribution varies with the male and female. So there is, females are generally considered to be more fatty and consist of more superficial fascia as compared to the males. Males are considered to be more muscular. Now subcutaneous layer. So one more thing is important for you to know, the subcutaneous collection of fat, the term is used and the term is called as panicula's adiposis. So prevent the heat loss and it is poor conduction of heat. In hairy mammals, panicula's adiposis is minimal and the skin is loosely attached to the deeper structure. So also it is important that a muscle, sometimes certain muscles are also lying in the super. We know that the muscles are covered by deep fascia and the muscle is lying next to the deep fascia, but at certain places we have seen also containing muscle, and that is a category of muscle is given a name that is called as panniculus carnosus. So you should know the difference between panniculus adiposis and panniculus carnosus. Panniculus carnosus is the superficial fascia which is containing flat sheet of muscle. The example of panniculus carnosus, where does, so this is very important, has been asked as an MCQ also, that you should know where does we find the panniculus carnosus. So all of you, yes, Rangraj and everyone, those who are listening, it is important for you to know the whole name of the muscle which is considered to be an example of panniculus carnosus. Remnants of panniculus carnosus muscles are muscles of face, scalp, platysma, palmaris brevis, corrugator cutis ani, dartos muscle and muscles of nipple. So these are the category of panniculus carnosus muscle, muscles of face, muscles of scalp, muscles platysma, palmaris brevis, corrugator cutis ani. This is the muscle lying near the margins, anal margin, dartos muscle. This is a muscle which is lying in the scrotum, and muscles of nipple. So these are examples of muscles, that is panniculus carnosus. Now, what is the function of superficial fascia? It is conversing. It is containing fat, so it converses the heat, body heat, facilitate the movement of skin and serve as a soft medium. It serves as a medium for the passage of blood vessel and nerve to the skin. So as you can see here, it is containing in the superficial fascia, it is containing macrophages, it is containing capillaries, white WBCs, adipocytes, and it contains certain fibers, collagen, elastic fibers. So actually it is containing fat, so it is conversing the heat, and it is also acting as a medium for the passage of blood vessels and nerves. Now next important features which we want to study, underlying, when you go for dissection, underlying the superficial fascia, the next layer which is residing is the deep fascia. So deep fascia is dense inelastic membrane. Okay, elasticity is less, it is inelastic membrane, and it separates superficial fascia from the underlying deeper structure. It invests the whole of the body beneath the superficial fascia. It is forming a covering. It invests whole of the body beneath the superficial fascia. It continues with the superficial fascia, sends septae between the muscles. So what it is forming? It is forming septae between the muscle. Intermuscular septa. So it will form intermuscular septa which will divide the whole limb into various compartments. Okay. So for example, whenever you go for dissection, you must have seen, for example, if I take the example of thigh region of lower limb, it is having anterior compartment, posterior compartment, medial compartment. These three compartment muscle is covered by the modification of deep fascia which is dividing it in that is called intermuscular septas. It also form fibroareolar sheath for the blood vessels and nerves. It is devoid of fat, very sensitive, and nerve never crosses subcutaneous bone. Actually what happens, deep fascia is not crossing a bone, but it gets blended with the bone itself, and with which layer? Outer layer of the bone, which is called as perosteum. So deep fascia is blending with the subcutaneous bone perosteum part. Now varies in the thickness. So let's see about the deep fascia variation. So it is in, for example, when we take an example of rectus sheath, the deep fascia is barely demonstrable. So it is not nicely demonstrable in case of rectus sheath, but in iliotibial tract it is well developed. Iliotibial tract, where do you see iliotibial tract? Any idea where do you see iliotibial tract? Any idea where do you see iliotibial tract? You must have seen, when you have seen the lower limb session, it is seen on the lateral aspect of the upper thigh regions, a deep fascia modification and get thickened their iliotibial tract. So, it is well developed there. Over the rectus sheath it is barely demonstrable. It is absent in which region? This is also important for MCQs. D fascia is absent in face and ischiorectal fossa. It is absent in face and ischiorectal fossa. It is well developed in the limbs and forms tight sleeve, and in the neck it forms a collar. Now, I would like to give you the name of D fascia distribution and modification. Different names are at different places. So, in relation to muscles, if you have studied the muscle class, I think we have done with this, you must have seen the muscle fibers is covered by a modification of D fascia which is called as endomysium, the whole of muscle bundle. So, when we are talking about a single muscle fiber, it is called as that covering of D fascia is called as endomysium, and the whole muscle bundle is having a covering that is called as perimysium, and the entire muscle is covered by a modification that is called as epimysium. So, these are the modification of D fascias. Okay, blood vessels and nerves will travel and lymphatics will travel through this septate. So, forms intermuscular septas which separate the compartment from functionally different groups. Different coverings for the muscle fibers is endomysium for the muscle fiber, perimysium for the muscle bundles, and epimysium for the entire muscle. Now, see here, this is how the diagram I want to just show you. Let me slightly enlarge it. So, here you can see this is a muscle fiber, and this muscle fiber is covered by endomysium. So, this is all endomysium. Single muscle fiber is endomysium. Now, entire muscle bundle is also covered by perimysium, and the whole muscle bundles, as you can see, is again having an outer covering, and this covering on the outer aspect, the whole of the muscle is covered. This covering is called as epimysium. In between this, blood vessels and nerves traverses. Now, the other modification of D fascia, as I told you, it is also formed in between the compartments. So, for example, it is taking an example of leg. So, posterior compartment of leg, anterior medial compartments of the leg. So, actually all these compartments, anterior, posterior, medial, this is for the thigh region, is having the intermuscular septas. Different group of the muscle is separated. In the leg region, we have got lateral compartment, we have got anterior and posterior compartment. So, all these compartments will have a modification of D fascia, intermuscular septas. Now, other than that, in relation to blood vessels also it forms a sheath. For example, in this category, what you can see, femoral sheath. So, here you can see I am just highlighting with green color. So, the sheath which is covering the vein, femoral vein and that of artery, this sheath which you are seeing is called as modification of D fascia, which is called as femoral. This sheath is called as femoral sheath. This sheath is called as femoral sheath. This is femoral sheath, which is covering the upper 3-4 centimeters of femoral vessels, femoral vein and femoral artery, but nerve is lying outside, it is not covered by the sheath. Other than that, actually it is also important that fascicle sheath covering over the veins is loosened as compared to artery, because it allowed distension of vein. In relation to nerve, for example, like same way as the muscle, it is in the relation to nerve, it is forming endoneurium, perineurium and epineurium. Okay, so send prolongation to covers the nerve. Individual nerve fibers, as you can see, is having a covering endoneurium. The whole nerve fascicles together is a covering of perineurium, and the entire of the nerve is covered by epineurium, and in between blood vessels is passing through the fasciculus. In relation to joints, so in relation to joint, it is forming synovial membrane, bursas, tendon, sheath. So, okay, synovial membrane will lines the inner aspect of, the inner aspect of the joint cavity, okay, D fascia. So, synovial membrane and fibrous capsule, these two structures as providing a strength and stability to the joint. These are two modification of D fascia. Also bursas. What do you mean by bursa? Bursa means a a pouch which is containing synovial fluid. So this bursa is also modification of deep fascia. Tendon sheath. So tendons is also having a covering of epitendinum, peritendinum, endotendinum. So these coverings is again formed by modification of deep fascia. So see here, this is a joint cavity, and in this joint cavity you can see the fibrous capsule. And if okay, so you can see here fibrous capsule, and underlying to the fibrous capsule synovial membrane. So these two structures, synovial membrane and fibrous capsule together called as articular capsule, is the two structure modification of deep fascia. Another modification is bursas and tendon sheath. Actually, if you will see, you must have gone through the dissection of anterior aspect of forearm in the close to the wrist on the lower aspect. There is flexure and extensor retiniculum. So there is flexure and extensor retiniculum not only in upper limb but also in the lower limb, which are keeping the muscle tendons together, and they are not being separated from each other. So keeping the muscle tendon together is done by retinaculum. Again, the retinaculum is modification of deep fascia. Tendon sheath bursas minimizes the wear and tear and minimizes the friction. So you can see this diagram here. You can see, for example, just below the acromial process of the scapula, this is subacromial bursa, which is again modification of deep fascia. So you can see bursa is lying here, that is just below, that is subacromial bursa. So what happens, for example, subacromial bursa is there, and also it is related to supraspinatus tendon. So a muscle having a smooth movement in relation to that of the joint, for that there is location of bursa. Many important bursas are there. Gluteofemoral bursa, trochanteric bursa is there, subacromial bursa is there, subcapsular bursa, infraspinatus bursa is there. So these all pex anserine bursa in the relation to the lower aspect in the knee joint. So all these bursas are modification of deep fascia. Now other modification of deep fascia is in relation to palms and soles. When we go for dissection, what you will see in the in the middle part of the palm, there is a fibrous thickening of aponeurosis. So this is called as palmar. What is that called as? This is called as palmar aponeurosis. Now same way in the sole also, when you will see the sole also, there is plantar aponeurosis. Okay, so actually in case of what happens in, so actually in case of the palm, if we talk about the palmar aspect, we want to give extra support or protection to the nerves and vessels residing here. Same way, there are so many nerves and vessels, as you can see in the diagram also, in the sole also, which will lie in the constant friction when one walks. So we want to protect the underlying nerves and vessels. So there is a thickening of deep fascia on the sole aspect. So these are again the modification of deep fascia termed as palmar and plantar aponeurosis. Now, my dear students, you must have done with the dissection of anterior abdominal wall. So when we go for dissection of anterior abdominal wall, the muscle arrangement is in the form of layers. So see, that is also that flattened. So when the muscle tendon become flattened, it is called as aponeurosis. So for example, in this diagram you can see, here you can see at the insertion point, this is the external oblique muscle aponeurosis. This is transverse abdominis muscle aponeurosis, and this is internal oblique muscle aponeurosis. So all these aponeuroses are meeting in the midline. So this is aponeurosis of external oblique muscle, which also leads to the formation of inguinal ligament extending from anterior superior iliac spine and PT, that is pubic tubercle. So these all flattened part of the muscles which you are seeing in anterior abdominal wall, these are all modification of deep fascia. Other than that, we have also seen in case of tibia and fibula in lower limb, and in case of radius and ulna in the upper limb, that we have seen that there is a connection between the bones, and this connecting link between the bone is called as intrusious membrane. So this is the intrusious membrane which is forming connecting link between the radius and ulna bone. Okay, so yes, there is a gap also here. So here this is the ulna bone which you are seeing, which is connected by the another bone, that is radius bone, and the interconnection between ulna and radius bone is by intrusious membrane, which is again the modification of deep fascia. So it is not letting the radius and ulna bone get separated. Same way in the lower limb also, in between tibia and fibula, there is intrusious membrane. Actually the transmission of weight from radius in between transmission of weight also in the upper limb occurs through the intrusious membrane. Now So if we want to just modify together the whole of the consideration of the function of deep fascia, it keeps the underlying structure in position, also preserves the characteristic features of the contour of the limbs, provide extra support for the muscle attachment, helps in the venous return and lymphatic return. It also assists in the muscles for their action by their tension pressure exerted by its own towards the muscle surface. Retinacula act as a pulley. So what is there is the formation of retinaculum flexor and extensor. So this is also providing an action of pulley which prevent the loss of the power, and friction is minimized by keeping the tendons in the position. Ligaments give strength and stability to the joint. What is the function? Ligaments is providing strength and stability to the joints. So degaments is also the modification of deep fascia. Clinical correlation, fascicle planes. So fascicle planes, which is defined by the deep fascia, is forming, it's also determining the course taken by the deeply connected pus. Okay, damage to deep fascia of the leg can affect the venous return, and it can lead, if it is the deep fascia is damaged, it can lead to accumulation of blood and fluid in the legs, and that is called as edema. Okay, Dupuytren contracture. What is Dupuytren contracture? Actually, whole of the palmar aponeurosis will go into flexion deformity. So the palm will be appearing like the whole hand will be appearing like this because of the deformity or the flexion deformity of the Dupuytren contracture. Deformity will take place in the finger, and it will lead to limitation of the movements. So the tendons and nerves are generally not involved, but it leads to the limitations of the movements of the fingers and that of the hand. So these are certain modifications of or the clinical correlations of deep fascia. So yes, Sri and everyone, have you understood? So my dear students, before ending the session, I would like to give you the information regarding my tomorrow's session. So special session, if you want to be present for the special free session on the Unacademy platform, so my dear students, you can use my code NEAT10. So first thing is that you have to download the Unacademy app. Then you have to find your goal as NEET PG, and thereafter, if you are using the Unacademy platform for the first time or downloading it for the first time and you want to see my session, just use the code NEAT10 to unlock. So also I want you to tell about my tomorrow's session. So tomorrow's session is NEET PG 2021 recall questions. So tomorrow's session is NEET PG 2021 recall questions, which I will take at 6 p.m. So you can join me for this session, 6 p.m. session, for the discussion of recall question of NEET PG 2021. So you can use the code NEAT10 to unlock the session and be present for this session. Also, I want to give you information regarding the free special classes. The free special classes, this is starting from 15 September 7 p.m. and joints, so general anatomy I have started, and I will also, yes, thank you Shri. So I will also cover up the general joints class. So this will be the class of joints, general anatomy joints class, where we will study different types of joints: cartilaginous joint, fibrous joint, synovial joint, different variety, ellipsoid joint, saddle variety, ball and socket variety, pivot joint, all these types along with the example of each type. So you can join me for the 7 p.m. session. So do join me for the 7 p.m. session. This will be a session which will again take place on the Unacademy platform, special class, free platform. Use the code NEAT10 to unlock and be present for the 7 p.m. session. Now my dear students, I also want to tell you about the opportunity which is given on the platform of Unacademy. So if you are going to take 2 years of subscription, you can use my code NEAT10. So you can use my code NEAT10 and get 4 months of subscription absolutely free and a discount of 10%. Also another, if you take a 12 months of subscription, you get 2 months of subscription absolutely free. So for this also you can use my code, so you can get 10%. So I also want to give you information right now. First 500 students will get, if you are going to take the subscription right now, first 500 students will get a discount more than 10%, that is approximately 15 to 20% discount. So thus avail that discount and be the part of the plus subscription of Unacademy. So also I would like to give you information regarding the session which is going to happen, which is starting from today, is Mine-On session. So those who are interested can go for it. So just professional third year batch, actually anatomy. So this is what anatomy will be taken by me, and this is a quick revision for the professional third year batches who want to target their next exam. So do join and take the subscription if you are interested for the whole anatomy, a whole 19 subject completed for you. Use the code ANAT10 to get 10% discount. Also clinical examination procedure batch is there. So this batch is starting from 15 September and third year batch starting from 14 September. So actually simultaneously on the platform of Unacademy, so many batches are going on, and first 500, those who are going to take the plus subscription of Unacademy, of the also iconic subscription, they are getting more than 15 to 20% discount. So just go and grab it. First 500 students only use my code ANAT10 and get 10% discount. Okay, so be present for the tomorrow session. That is the two sessions. One is at the 7 p.m. that is general anatomy joint session, and another is the NEET PG 2021 anatomy recall MCQ. So you can be the part of that session. All the best. Keep studying. This is 6 p.m. session. Thank you. All these two sessions are on the free platform of Unacademy. So do join and present for tomorrow's session. So we will meet exactly tomorrow on the Unacademy platform at 6 p.m. and then at 7 p.m. Thank you. Thank you, students. Thank you so much.